Yes, MK the guy. Let's talk about the sites of different drugs now. From here, this is phospholipase A2. And phospholipase A2 is to the production of arachidonic acid. This enzyme can be inhibited by glucocorticoids. Glucocorticoids, for example, the cortisol, the cortisone, these ones lead to production of annexins. Annexins, an example is leukotriene. This one inhibits the production of phospholipase A2. The leukotriene inhibit the production of phospholipase A2. So, meaning that all these other prostaglandins and leukotrienes won't be produced due to glucocorticoids. Now, when it comes to the COX, this COX enzyme leads to the production of all other prostaglandins. Doesn't lead to the production of LOX or the leukotrienes. This pathway can be inhibited by NSAIDs. So, NSAIDs, for example, the aspirin, indomethacin, the diclofenac, the coxib, they can inhibit this pathway. But for coxibs, has these enzymes, these drugs, the coxib, the colecoxib, they have high affinity for COX2, but we shall talk about that later. So, they need the COX enzyme. Aspirin, this aspirin causes the permanent or the irreversible inhibition, and we shall also talk about it later in the pharmaceutical chemistry of the NSAIDs. We shall talk about the NSAIDs broadly in pharmaceutical chemistry. Now, prostaglandin G2 can be converted to prostaglandin H2 by the COX. The cyclooxygenase active site of this COX leads to the production of the prostaglandin G2. Then prostaglandin then goes to the peroxidase active site. This OH group, the peroxide group is cleaved to produce the OH group. So prostaglandin H2 is produced. Then from prostaglandin H2, all other prostaglandins, they are produced. Now, we have different agonists and antagonists of different metabolites. For example, prostaglandin G2, we say that different prostaglandins have different activities depending on the sites where they are produced. For prostaglandin G2, prostaglandin E2, it's produced in different sites. It can be produced in the mucosa of the GIT. Also, its production in the endometrium leads to the contraction of the uterus, and also can lead to cervical ripening. So, the prostaglandin E2 pessaries can be used for cervical ripening. And also, we have drugs like the dinoprostone. This drug can be used for mid-term abortion. So, due to the activity on the uterus, leads to a contraction. So, it can be used in mid-term abortion. Then, prostaglandin F2 alpha. This one, we have different drugs. One of them is the carboprost. This drug can be used as an alternative to the ergometrine and also to the oxytocin in controlling the postpartum hemorrhage. So it can stop the postpartum hemorrhage, carboprost. We have drugs like latanoprost. This drug can be used in treatment of wide-angle glaucoma. The latanoprost, the travoprost, also the bimatoprost. These three drugs can be used in treatment of wide-angle glaucoma as they increase the aqueous humor, the drainage, these drugs. Then we have other drugs like here at prostaglandin I2, the prostacyclin, epoprostenol, and iloprost. These drugs, they are agonists of the prostaglandin I2 or the prostacyclin. This one, it can be used in hemodialysis. In hemodialysis to prevent coagulation or the clotting, and also in cardiopulmonary bypass. Cardiopulmonary bypass to prevent coagulation. Iloprost, it can be used in the pulmonary artery hypertension. Because it can lead to vasodilation. Remember, the prostacyclins, they are antagonists to the thromboxane. This thromboxane can lead to platelet aggregation, but this one, they prevent platelet aggregation. So that's why they are used for this purpose. These ones, they are made in the platelets. These ones, we say that they are produced mainly in the endothelium of the blood vessels, and this is mainly by COX-2 enzyme in endothelium. So COX-2 has also constitutive activities, we said, in the endothelium of the blood vessels, in the ductus arteriosus of the fetus, also in the kidney and some parts of the brain. Though its production can be induced, and when it is induced, can lead to inflammation. Then we have those drugs. Now, when it comes to the LOX pathway, here at first 5 LOX, we have drugs like Zleuton. This drug inhibits the 5 LOX, and when it inhibits this pathway, when it inhibits this enzyme, means that we shall not have production of the leukotrienes. We shall not produce leukotrienes. So, but this drug was withdrawn from the market due to its toxicity. It was withdrawn from the market. It could lead to liver toxicity. Now, this drug was used mainly in the asthma, to prevent the asthma. Now, there are some other drugs or the alternatives. For example, we have the montelukast. This drug is a leukotriene D4 antagonist. It is antagonist of this leukotriene. meaning that this drug can be used in management of asthma. We have also the zephyrocast. This drug, it is antagonist of the prostaglandin D4 and also prostaglandin F4. So these two drugs can be used in management of asthma because leukotrienes lead to bronchial constriction, and so the antagonist will reverse, so will lead to dilation of the bronchiole. Now, which drug? We have here at prostaglandin D2, we have a drug called daralopiplant. This drug is used in niacin-induced vasodilation. Niacin-induced vasodilation. Also, we have another drug here at F2 alpha, the Prost F2 alpha. It's an agonist of the prostaglandin F2 and can be used in the same way as dinoprost in the midterm abortion. You can see that for the agonists, or the stimulants, you can see that they have prost everywhere. We have prost, dinoprost. Are you seeing here epoprost, iloprost, mean that they are prostaglandin agonists. They are agonists. But for other drugs, for example, you see montelukast, zephyrocast, they are not agonists, but they are antagonists. So they don't have these prosts. But when you see the iloprost, epoprost, prostenol, see, they have prost, meaning that they are agonists. We have drugs, though not here, prostaglandin E. Prostaglandin E1. Prostaglandin E1, we say that the main precursor of the prostaglandins is arachidonic acid. And this arachidonic acid is a tetra fatty acid. We have, it's a tetra ecosa, or it's the ecosa tetraenoic acid. But we have also the penta, mean that fatty acid have 5 double bonds. This one has 4. Plus, we also have the tri. For it will be having 3 double bonds. But this one is a ecosa tetraenoic acid. Enoic acid. It has 4 double bonds. But other prostaglandins can be produced from other fatty acids. For penta, meaning that after cyclization, we shall have 3 double bonds. After cyclization, we lose 2 bonds. 2 bonds are saturated. But if it is tri, meaning that if the 2 are saturated, we remain with 1 double bond in the side chain. So prostaglandin E1 is produced from the from ecosa trienoic acid. Meaning that the 2 bonds are saturated, we remain with 1 bond in the side chains. So we have drugs like misoprostol. This is a prostaglandin E1 analog. And remember that we said that prostaglandins in the GIT can increase the mucus production, and also inhibit the production of the gastric acid in the stomach. So this one is a mucosal protectant. Some mucosal protectant. So it can be given with NSAIDs. Remember, NSAIDs will inhibit the production of the prostaglandins. So when we need NSAIDs for analgesic purpose, we can use the NSAIDs with misoprostol, such that this one protects the GIT, preventing the side effects of the NSAIDs, as we shall see that NSAIDs can lead to the peptic ulcers. So this one protects the mucosa of the stomach. Also, this drug can be used in the early abortion, because that prostaglandin E1 can lead to the uterine contraction. So during the early pregnancy, this drug can be used in abortion. We have another drug called Prostadil. Prostadil, this drug can be used in neonate, to prevent the closing of the ductus arteriosus in case there is a defect with the heart. So this drug can be used to prevent the closure of the ductus arteriosus until the surgery is done. And also, this drug by injection can be administered in the penis it can lead to the erectile or the erection, can lead to erection for about 1 to 2 hours. This drug, if it's injected in the penis, but it was substituted by other drugs such as sildenafil. Yes, thanks for watching. Same kind of guy. Please don't forget to subscribe, like the videos, and share. We shall talk about the NSAIDs, and also we have some questions about aspirin being given low doses and high doses. We also talk about the COX-3, because here we have talked about the COX-1 and COX-2. We are going to talk about the COX-3 and paracetam, how it inhibits the COX-3. But all those are in the next videos. So thanks for watching. Wait for the part 2 of this video. Thanks so much.